Can you can you hear me?
Yes, ma'am. Good evening, ma'am.
Yeah, good evening. Okay, so among VVM is there, vaccine vial monitor. Yesterday we had discussed about VVM. VVM किसके लिए हम use करते हैं? Vaccine vial monitor, that is called as VVM. Okay, so what is the purpose of VVM? What is the purpose of VVM? What is the purpose of VVM? पर्पस हमका पर्पस क्या है VVM का? Can you able to see
कितने?
the board?
Yes.
Yeah, to assess the potential of the vaccines, whether we can use the vaccine or vaccines का discard करना है, इसलिए we are using an VVM. VVM is the one which is helping to assess whether we can use VVM or whether we have to discard the vaccines. Vial can be used or vial can be discarded. So either vial can be used or vial can be discarded. Okay. So next what we are generally these also repeated question पूछते रहते हैं मतलब ना काफी टाइम ना these questions एग्जाम में आते रहते हैं. Okay, so ideal time to store the vaccine. Okay, so ideal temperature for store and transport of vaccine 2 to 8 degrees Celsius. Okay, ideal time for an ideal temperature for the vaccine store and transportation of vaccine. Okay, ideal temperature for store and transportation of vaccine 2 to 8 degree Celsius. For an 2 to 8 degree Celsius. Ideal temperature for store and transportation of the vaccines. Okay, then again repeated question. PFA Act, Prevention of Food Adulteration Act. One more act in their community में एक और act है Prevention of Food Adulteration. हमने food adulteration का हमने prevent करना है. Okay, so Prevention of Food Adulteration Act. So we can call it as an PFA Act. Okay, we can call it as an PFA Act. So PFA Act was started in the year 1954. This is also repeated question. Okay, so PFA Act, when it was started in the year 1954. PFA Act was started in the year 1954. Then one more repeated question, community में repeated question. So autoclave sterilization, steam under pressure. So हमने instrument को है ना autoclave करते हैं. Okay, so autoclave otherwise called as sterilization. Autoclave otherwise called as sterilization or otherwise called as steam under pressure. Okay, steam under pressure, autoclave otherwise called as sterilization or otherwise called as steam under pressure. Okay, so इसके कितना टेम्परेचर चाहिए? So 121 डिग्री सेल्सियस 20 मिनट के लिए हमने ऑटोक्लेव करना है 121 डिग्री. दिस इज रिपीटेड क्वेश्चन. ओके, 121 डिग्री सेल्सियस फॉर एन 20 मिनट्स. देन उसके बाद हमने ना 135 डिग्री सेल्सियस में मतलब ना अगर टेम्परेचर का हमने इंक्रीज करते तब आएगा 15 मिनट. Okay, 135 degree Celsius for an 15 minutes. Okay, so ideal temperature of store as well as vaccine का store करते हैं transport करते हैं तब हमने use करना है 2 to 8 degree Celsius. Then PFA Act मतलब Prevention of Food Adulteration Act. This was started in the year 1954. So autoclave हमने autoclave हम बोल सकते हैं that is sterilization. हम ऐसे भी बोल सकते हैं steam under pressure. इसमें क्या आएगा 121 डिग्री सेल्सियस में 20 मिनट तक करना है. सपोज अगर 135 डिग्री हमने टेम्परेचर का ज्यादा कर लिया तब ओनली 15 मिनट. 135 डिग्री में 15 मिनट्स इज इनफ. ओके, दिस इज अबाउट कितना हाउ विल डू एन ऑटो हाउ वी हैव टू डू एन autoclave. How we have to do an autoclave. So the next we are going to discuss about an another one more thing I want to tell. हमको पता है, हमको क्या पता है we know BCG वैक्सीन है. BCG तो हमने लास्ट क्लास में पढ़ा है क्या? दिस इज एन लाइव वैक्सीन. इसका हमने रिकंस्टिट्यूशन डाइल्यूशन करने के लिए क्या यूज करते हैं प्रियंका? ओके, रिकंस्टिट्यूशन करने के लिए डाइल्यूशन के लिए क्या सॉल्यूशन यूज करना है? क्या सॉल्यूशन यूज करना है बीसीजी डाइल्यूशन के लिए? एनएस
नॉर्मल सलाइन.
हाँ जी, नॉर्मल सलाइन. वेरी गुड. Very good. So the BCG, so like for reconstitution, for dilution of BCG, so we have to use an NS. Okay, NS is used. Very good. For example, other vaccine अगर measles है, measles में भी powder form में आएगा. Measles का dilute करने के लिए क्या use करना है? Measles का dilute करने में क्या use करना है?
Distill water.
Very good, very good. For measles, for dilution of measles, we have to use an distilled water for reconstitution. Yeah, for dilution, we have to use an distilled water can be used. For reconstitution of vaccine, for dilution of vaccine, we have to use an like a distilled water to be used. Okay, distilled water to be used. Very good. So ideally, so कितना time तक use करना है? Ideally कितना time तक use करना है? Okay, so usually like an after like a reconstitution हमने कर लिया. Other vaccines, all other vaccine to be used, distilled water to be used. All other vaccine to be distilled water is used. Okay, then like generally like a reconstituted measles. Okay, अगर measles है measles ने हमने mix कर लिया, NS से mix कर लिया, that should be used within 4 hours. अगर like we took measles from the refrigerator. Okay, so reconstitution within 4 hours we have to use. Okay, then BCG vaccine है, हमने within like that also BCG should be used within 4 hours. BCG also should be used within 4 hours. Then rotavirus drop. Okay, so like हमने fridge से निकल गया within 4 to 6 hours. Rotavirus should be used within 4 to 6 hours. Okay, then JE vaccine, Japanese encephalitis, that should be used within 2 hours. That should be used within 2 hours. Yellow fever, like okay, so like these vaccine should be these are also repeated question. अगर हमने vaccine का reconstitution कर लिया, then कितना time तक हमने use करना है? मतलब measles वाला 4 घंटे में use करना है, BCG का हमने 4 घंटे में करना है, रोटावायरस का हमने 4 to 6 hours में use करना है, Japanese encephalitis का हमने 2 घंटे में use करना है. Then as per open vial policy, हमने एक वैक्सीन का हमने ओपन कर लिया. ओके, सपोज मैंने आधा यूज किया. ओके, फॉर एग्जांपल डीपीटी, फॉर एग्जांपल ओपीवी, फॉर एग्जांपल डीटी. ओके, सो एनी वैक्सीन हमने ओपन वायल पॉलिसी, एक वायल का हमने ओपन कर लिया, फिर हमने मैंने आधा यूज किया, तो उसका हमने क्या करना है? फॉर दैट व्हाट वी हैव टू डू? That should be used within open vial policy, that should be used within 28 days. Am I correct? Any vial हमने open कर लिया. As per open vial policy, this was initiated in 2015. Open vial policy they got started in the year 2015 recently. Okay, so any vaccine हमने open किया, open वाला vaccine that should be used within 28 days. Okay, that opened vial that should be used within 21 days. Okay, so 28 days. Is it clear?
Yes, ma'am.
Yeah. Next. So what are all the side effects of vaccines? Something like coffee vaccines yesterday we had studied. Okay. So what are all the side effects of vaccine? Okay. So side effects of vaccine, अलग-अलग vaccine का अलग-अलग है. Okay. So side effects, vaccine का side effect क्या है? Okay. So BCG vaccine का side effect is suppurative lymphadenitis, मतलब pus formation. Suppression का मतलब क्या है? Pus formation. Okay. like हमने साइड में वैक्सीन दे दिया, so they will have suppurative lymphadenitis. Okay, so we have to like a patient may develop suppurative lymphadenitis, BCG infection, BCG induced infection. BCG induced infection, fever, pain, scar. Okay, so fever, pain, scar. Okay, that is like occur within 2 to 6 months of vaccination. Okay, so this will occur because of BCG vaccine. Number 2, OPV vaccine. Because of OPV vaccine. Okay, so OPV vaccine occur, that is VAP. OPV का साइड इफेक्ट क्या है? VAP. VAP का मतलब क्या है? वैक्सीन एसोसिएटेड पैरालिटिक पोलियो. ओके, सो वैक्सीन के साथ, ओके, सो लाइक हमने ऐसे भी बोल सकते हैं वैक्सीन एसोसिएटेड पैरालिटिक पोलियो. पैरालिटिक पोलियो. मतलब वैक्सीन के साथ पोलियो बन जाएगा, ओपीवी। ओके, वैक्सीन एसोसिएटेड पैरालिटिक पोलियो। ओके, हेपेटाइटिस बी वैक्सीन, HBV वैक्सीन, हेपेटाइटिस बी वैक्सीन का साइड इफेक्ट क्या है? एनाफाइलैक्सिस। एनाफाइलैक्सिस मतलब सीवियर एलर्जिक रिएक्शन। ओके, सो हेपेटाइटिस बी वायरस का साइड इफेक्ट क्या है? एनाफाइलैक्सिस। ओके, देन नेक्स्ट इज एन व्हाट इज द साइड इफेक्ट ऑफ पेंटावैलेंट? ओके, व्हाट इज द साइड इफेक्ट ऑफ what is the side effect of pertussis? Pertussis. Okay, so pertussis may have a persistent cry. Persistent cry, hypotonia, encephalopathy. Okay, so this will occur because of pertussis vaccine. Okay, so like a measles vaccine may cause febrile illness. Okay, measles vaccine, side effect of measles. Measles, because of measles vaccine, so there may be a febrile illness. SSPE, subacute, okay, subacute pan sclerosing panencephalitis. So like in SSP, so SSP मतलब क्या है? Subacute pan sclerosing pan encephalitis. So किसके साथ बन जाएगा? This is occur due to measles vaccination. Measles vaccination cause SSPE. Okay, then specially rotavirus drops. हमने rotavirus देते हैं ना, rotavirus for diarrhea. Rotavirus vaccine for an diarrhea. Rotavirus हमने yesterday we had discussed ना, like we'll give 4 to 6 drops. Okay, so 6 weeks, 10 weeks, 14 weeks we have to give 3 doses. So which may cause intussusception. Telescoping of one lumen of bubble into an another lumen. That is called as intussusception. Okay, so patient may develop an intussusception. Is it clear? Is it clear, Madhu? Okay, side effects of vaccination. So what all the vaccines are there? What vaccine? Which side effect it will cause? Which vaccine? This will cause which side effect? Okay, is it clear?
Yes, ma'am.
Yeah.
Yes, ma'am.
Yeah, fine. Next also, these all are repeated question exam point of view. Okay, then next is then proximate policy. मतलब क्या है? हमको body में कितना nutrient कब चाहिए? That is called as proximate policy. Proximate policy. Carbohydrate that provide 4 kilocalorie per kg body weight. 4 like a carbohydrate, how much carbohydrate? Like a carbohydrate 4 kilocalorie per gram. Always carbohydrate means. Protein, how much calorie that will provide? Okay, 4 kilocalorie per kg body weight. Then कभी कभी पूछते फैट कितना कैलोरी देते? फैट थोड़ा काफी देते, 9 किलो. वेरी गुड, ब्यूटीफुल. 9 किलो कैलोरी पर केजी बॉडी वेट. मतलब फाइबर कितना देते हैं? फाइबर डाइट 2 किलो कैलोरी. फाइबर विल बी, या 2 किलो कैलोरी. वेरी गुड. अल्कोहल पीते ना, like that alcohol will give 9 kilocalorie. Okay, so as per proximate policy, carbohydrate gives 4 kilocalorie, protein gives 4 kilocalorie, fat gives 9 kilocalorie, then like a fiber gives 2 kilocalorie, then like an alcohol gives 7 kilocalorie. Alcohol given 7 kilocalorie. Okay, is it clear?
Yes, ma'am.
Yes, ma'am.
Yeah, very good. Next, कभी कभी ऐसे भी कुछ क्वेश्चन आएगा, like especially PGI Chandigarh. So PGI question, PG and AIMS. Okay, so like we'll have food adulteration. Food adulteration का मतलब क्या है? Adulteration हिंदी में क्या बोलते हैं? Food adulteration का adulteration हमने क्या बोलते हैं हिंदी में? What we can say in Hindi? Food adulteration.
जो मिक्सेशन करते हैं, मिक्स करते हैं फूड में.
हाँ जी, हाँ जी. This may also ना like that oil na, like cooking oil, so we are adding some other oil, Okay, palm oil like that we are adding now. That is called as food adulteration. Food adulteration in the sense the substances which added in the food. Okay. For example, chili powder and brick powder, chili powder. Then sand with the turmeric powder, mustard oil with arjumon oil, like that. Arjumon seed with mustard seed. Food adulteration is in substance added, some substance. So something for substance added that reduce nutritive value. Okay, some substance तो हमने add कर लिया, but उसमें ना like that reduce nutritive value का कम करते. For example, अगर हमारे चिल्ली पाउडर में ब्रिक पाउडर ऐड करना क्या होगा, पसंद बन जाएगा नहीं. Okay, so that kind of thing is called as adulteration, which harm the health, reduce nutritious value, harm to health. Okay, sometimes it may be a harm to health. Okay, that is called as food adulteration. Then what is mean by food additive? Adulteration alage. What is mean by food additive? Okay, so additive is some substances to the food that does not alter nutritive value. So additive also like some substances added. Some substances add kar liya, but nutritive value not altered. Okay, nutritive value same रगेगा. Nutritive value not altered. Nutritive value not altered. The nutritive value तो altered नहीं होगा, not altered. That is called as food additive. For example, like flavors, preservative. We are adding some flavor. We are adding some preservative. Okay, so उसमें ना क्या होगा, like इनको ना color बन जाएगा. Okay, preservation बन जाएगा. But उसमें ना nutritive value add like a nutritive value कम नहीं होगा. मतलब फूड एडल्ट्रेशन का मतलब क्या है, वी आर एडिंग सम सब्सटेंसेस. ओके, उसमें तो न्यूट्रिटिव वैल्यू कम होगा, न्यूट्रिटिव पर्पस कम होगा. दैट इज कॉल्ड एज एडल्ट्रेशन. बट फूड एडिटिव तो कोई दिक्कत नहीं. फूड एडिटिव इन द सेंस सम सब्सटेंसेस वी आर एडिंग टू द फूड that does not alter the nutritive value. इसमें तो ठीक है. Okay, food additives are ठीक है, but food adulteration is not good. Food adulteration is not good. Okay, is it clear? Then what is mean by food fortification? Fortification मतलब क्या है? What is mean by food fortification? Fortification is nice, no? Food fortification. Adding additional nutrients. Okay, adding additional nutrient. Adding additional nutrient. मतलब ना हमने like adding additional nutrients. मतलब ना थोड़ा ज्यादा न्यूट्रिएंट हम ऐड कर रही है. एग्जाम्पल आयोडाइज्ड साल्ट. ओके, सो मतलब लाइक साल्ट में थोड़ा आयोडीन होगा, बट व्हाट विल हैपन, आयोडाइज्ड साल्ट में काफी आयोडीन वी आर एडिंग टू द साल्ट. तो मतलब ना अगर उसका लाइक फूड फोर्टिफिकेशन, मतलब वी आर एडिंग सम सब्सटेंसेस which increase the nutritive value. Okay, adding some substances which increases the nutritive value. That is called as food fortification. That is called as food fortification. Food enrichment. That also अच्छी बात है. Food enrichment. Food का हमने enrich कर रही हूँ. Enrichment. Okay. So मतलब this is previous aims question. Food enrichment मतलब increasing quality. Okay, इनको क्वालिटी का हम ज्यादा करते. एग्जाम्पल स्प्राउटेड दाल. ओके, एग्जाम्पल स्प्राउटेड दाल. ओके, सो अगर हमने लाइक दाल तो स्प्राउटेड करने के बाद ना which increases add upon the nutritive value. So nutrition value will be adding up. Okay, that is called as food enrichment. That is called as food enrichment. Is it clear? Is it clear?
Yes, ma'am.
मैम
Yes,
लिखा है ये?
ma'am.
हाँ जी.
एग्जाम्पल बताना क्या लिखा है इसका एनरिचमेंट का.
स्प्राउटेड दाल. स्प्राउटेड हिंदी में क्या बोलते हैं? स्प्राउटेड मैं भूल गई. स्प्राउटेड दाल हमने ना लाइक ग्रीन ग्राम दाल है ना, उसका हमने ना लाइक पानी में डाल के 1-2 दिन, उसके बाद इसके निकाल के लाइक विल टाई विद द क्लॉथ. देन आफ्टर दैट इट विल कम, नो, लाइक the sprout used to come. Then after that we used to eat and we used to cook. That is called as food enrichment. Simple dal, simple green gram dal ka upar, which is like a good, no, sprouted dal. You are
Yes,
getting
ma'am.
samaj ke na what is sprouted dal?
Yes, ma'am.
It
Yes,
increases,
ma'am.
न्यूट्रिटिव पर्पस का इंक्रीज करते हैं. Okay, yeah, very good. Okay, so like a protein का requirement कितना है? That is repeated question. Okay, protein का requirement कितना है? और like a carbohydrate requirement कितना है? Okay, calorie requirement, calories requirement कितना है? So calorie requirement for a yeah sedentary worker अलग है. Sedentary मतलब काम कुम कुछ नहीं होगा, like a sitting work, sedentary worker. Okay, sedentary worker का like we are having for female, male अलग है. Female का 1900, this is for male का 2300 kilocalorie. Okay, per day, sedentary worker. Then moderate worker मतलब like थोड़ा बहुत काम तो होगा, not heavy. Okay, for male and female अलग है. For female, moderate worker for female, it is 2200. For male, it is 2700. Okay, then heavy worker तो ज्यादा चाहिए. For male and female and male, for female it is 2800. For female, it is 3500. Okay, so you are getting caloric requirement for a sedentary woman, it is less than for moderate worker. This is little bit increase. For heavy worker, they may need a more calorie. They may need a more calorie. समझ के कितना calorie चाहिए? Then next is then what about their protein requirement? Okay, what about their protein requirement? Okay, so the protein requirement generally और daily recommended allowances कितना होना चाहिए for an adult? Suppose like an protein requirement for adult usually 1 kg per 1 gram per kg. Okay, this is standard concept. Okay, 1 gram per kg per day. Okay, for an adult. For a child का infant का थोड़ा ज्यादा चाहिए. तो infant का थोड़ा ज्यादा चाहिए. कितना चाहिए? 1.16 to 1.7 grams per kg per day. Okay, then for pregnancy कितना चाहिए प्रोटीन? Pregnancy में हमको additional plus whatever routine we are getting, no, like a plus 28 grams per day. For lactation, lactating mother, lactation 0 to 6 months, 6 to 12 months. So lactation का like an initially additional 19 grams per day. For lactation later 11 to 13 grams per day additional. Okay, then here like here also we have to note one sentences. Calorie requirement during pregnancy plus 300, lactation plus 550. Okay, calorie requirement you are getting now. During pregnancy additional calorie plus 300, during lactation additional calorie plus 550. So the protein requirement for an adult 1 gram per kg per day, during pregnancy plus 28 grams per day. Okay, for infant it is 1.16 to 1.7 grams per kg per day. During lactation, like first 6 months it is plus 19 grams, 6 to 12 months plus 11 to 13 grams per day. Additional protein is necessary. Additional protein is necessary. Is it clear? समझ है?
Yes, ma'am.
हाँ जी, for
Yes,
everyone.
ma'am.
Yeah, बढ़िया. Next अगर repeated question पूछते रहते ना, what is this ना? Like amino acid deficient in, repeated question. किसमें amino acid कम होगा? क्या amino acid कम होगा? As a type of question. Amino acid deficiency in, deficient in. So कौन सा में which amino acid can be deficient? Okay, so the repeated question, cereals. Okay, so cereals में which amino? Cereals are lysine. Cereals are deficient in lysine and threonine. Lysine and threonine deficiency. Cereals may have lysine and threonine deficiency. Number 2, pulses are deficient in. Okay, pulses are deficient in cysteine plus methionine. Okay, pulses are deficient in cysteine and methionine deficiency. Then maize eating population. Okay, so maize eating population may have a lysine plus tryptophan deficiency. Lysine and tryptophan deficiency. Maize eating population, lysine and tryptophan deficiency. Okay, so generally one more universal question, maize eating population, maize eating population. So only sometime now they will use maize eating population, or otherwise, or we can call like a tryptophan, because maize eating population may have tryptophan deficiency, either maize eating population or tryptophan deficiency. Both will cause both is associated with niacin deficiency. Both associated with niacin deficiency. What is niacin? Niacin is vitamin B5. B5 niacin deficiency. Okay, so these four points are very very important. Number one, number two, number three, number. Okay, cereals and pulses. Cereals are lacking lysine and threonine. Pulses are lacking cysteine and methionine. Maize eating populations are lacking lysine and tryptophan. Generally, maize eating population or tryptophan deficiency associated with vitamin B5 or niacin deficiency. So, niacin expressed by, what are the 4Ds of niacin deficiency? It is expressed by 4D: diarrhea, dermatitis, dementia,
Dementia.
death. So it is expressed by diarrhea, dermatitis, dementia. Untreated cases lead to death. Untreated cases may lead to death. Is it clear?
Yes, ma'am.
Everyone?
Yes.
Yeah. Okay. So which micronutrient which micronutrient helps in insulin secretion? Which micronutrient helps in insulin secretion? Number one, zinc. Number two, chromium. Insulin secretion. Okay, this is repeated question. So which micronutrient helps in insulin secretion? So which aid in insulin secretion? Okay, which aid in insulin secretion? Number one is zinc. Number one is zinc. Number two is chromium. Okay, is it clear? Then one more repeated question. One more repeated question. Okay, one more repeat. Many times the questions they had asked, even RRB. Now na RRB ES exam also आने वाला, PG Chandigarh आने वाला. Okay, so PG Punjab already they gave a recruitment already they gave recruitment. Okay, AIMS also आने वाला. So काफी exams are yet to come. Okay, so these kind of questions are very expected. Okay, so again and again repeated question. Red tongue, red color tongue. Tongue will be looks very red color tongue, or magenta tongue, magenta color. Okay, so which is magenta color? Yeah, this is called as magenta. Okay, red color tongue or magenta color tongue occur due to B2 deficiency, not B12 deficiency. Then next is an uh, B dark red tongue, beefy tongue or dark red tongue, beefy or dark red, seen in B deficiency. Raspberry or strawberry tongue. Raspberry tongue or strawberry tongue. Scarlet fever. Okay, so red tongue, magenta tongue, that is seen in vitamin B2 deficiency. Beefy tongue and dark red tongue, which is seen in vitamin B12 deficiency. Then like a raspberry tongue, strawberry tongue, which is associated with an scarlet fever. Okay, is it clear?
Yes, ma'am.
Yes, ma'am.
Okay, then next. 1 minute. Okay. 1 minute, 1 minute. Okay, so like the next important question is related to pasteurization of milk. So like a milk pasteurization, that is repeated question. Milk pasteurization. So what is meant by pasteurization? Milk sterilization, warming of milk. So pasteurization of milk. Okay, pasteurization. So how this is repeated question. Pasteurization of milk is a very often repeated question. Okay, so the pasteurization of milk, there are three methods are there. In the pasteurization of milk, there are three methods are there in the pasteurization. So which is divided into three. Okay, so number one, the first method, number two, the
Boiling.
then the third method. Okay, so the first method is VAT method or Holter method. Okay, so we can call it as an VAT or otherwise called as holder method. So VAT method or holder method. The first method. Second method is HTST method. Second method is an HTST method. Okay, so what is HTST method? High temperature and short time method. Okay, the HTST method is an high temperature. We can call it as a high temperature, short time method. High temperature and short time method. Number three, it is called as UHT method, ultra high temperature method. So number three is an UHT method, ultra high temperature method. Ultra high temperature method. So VAT method. So in the VAT method, so especially like which is like a temperature used, which is commonly followed in rural areas. Okay, so we'll use 66 degrees Celsius. We'll use only 68 degrees Celsius. Why it is called a holder method in the sense holder, hold for like thoda se garam. Okay, hold for 30 minutes. हमने 66 degrees Celsius 30 minutes then cool down. Okay, then cool. Aram se we have to make it cool. Next, HTST method in urban areas. HTST method is in an urban area. Okay, so the temperature हमने ना like more than 72. Okay, 72 degrees Celsius हमें कितना तक करना है? Then उसके बाद cool. Okay, इसके बाद we have to cool it. Then next method is called as UHT method. UHT method, like a UHT method will be go like more than 125 degrees Celsius. Okay, so like a high temperature plus they will give high pressure also. High pressure, like a high temperature as well as high pressure, then cool it down, cool down. The cabin's milk, some milk now like some milk like a milk packet are there, it can be kept in room temperature for 1 month. Like that, we are their advertisement they are giving up milk mein doodh. Okay, we are getting that is called as like some packet we can keep for 10 days, 15 days in like without refrigerator. Okay, that is called as UHT milk. Okay, so VAT method, HTST method, UHT method. VAT method 66 degrees Celsius. Then HTST method 72 degrees Celsius. Then UHT method it will go 125 degrees Celsius, which is helping for an pasteurization. Which helps for an pasteurization. Then actually there are some tests also repeated question. Test also repeated question. The test like we are using for an like test for an unpasteurized milk. So we can call it as an raw milk. तो अगर रॉ मिल्क है इनका क्या टेस्ट करना है रॉ मिल्क लिए हमने मेथिलीन ब्लू टेस्ट ओके सो फॉर लाइक व्हाट इज द टेस्ट फॉर एन रॉ मिल्क मेथिलीन ब्लू टेस्ट okay methylene blue reductase test methylene blue test okay methylene blue test for example agar like a milk is there so we will took a milk add